I mean, we're essentially COVID has put the whole world into a wartime scenario where you're just doing stuff you'd never dream of doing out of necessity, such as 3D printing a mask.
Hello, everybody. Today on the second episode of the Moot Podcast, I have with me Dr. Chris Wiles. Chris is a first-year resident at UConn and Hartford Hospital. He has been spending the last few months treating COVID patients and working on his 3D printed mask project to meet demand, which has been some of the demand we've been dealing with recently. Chris, say hi to everybody.
Hi, everybody. Thank you for having me.
Happy to have you here, Chris. How about first you start with some of your backstory, and then we'll get into how you came to 3D print these masks.
Well, I'm from Connecticut originally. I did most of my undergraduate training in New York State, as well as my medical school in New York State, in Long Island specifically. And now I'm happy to be back in Connecticut here at the University of Connecticut is the anesthesia program I'm in. It's a 4-year program, and I get to work at UConn, Hartford Hospital, St. Francis, and possibly a few other locations. So, I mean, growing up, I always was very involved in building things, various projects, very hands-on. I was always considering engineering, but also medicine. I was an EMT in college, and I really liked the aspects of working directly with patients and people, being part of a team. So I ended up deciding on medicine, and then I kind of was thinking surgery for a long time. Again, I'm a very hands-on person, which will relate to the masks. I'm sure we're going to talk about at length.
Of course.
Then I ended up learning about the field of anesthesiology, which really became my calling. So that's how I found myself here. And then right during my first year, my intern year, COVID-19 pandemic hit us.
How has it been so far from a frontline perspective? I can only imagine.
It's definitely been challenging. I got so involved with the mask project that I haven't been as involved. In the beginning, I was in the emergency department working there when this all started. And then I was actually going to be in the ICU, and I got swapped out with one of my colleagues so that I was able to focus on masks. But I still was in the hospital almost every day of the week, bringing masks and face shields and other PPE, up to the floors in the ICU and talking with everybody. So I have been pretty involved, and I can tell you that it's challenging to summarize it all because every location has a different experience.
Right.
Here in Connecticut, we definitely haven't. We've been lucky. We haven't been hit as hard as some of the major cities like Boston, New York, Detroit, New Orleans. Places in California and Florida, all over really. Any big hotspots like that. But our county is one of the hardest hit in the state of Connecticut, and our hospital is one of the biggest in this county. Is the biggest. So yeah, it's been challenging. I think one of the hardest things is the fact that you want to help people as much as you can in every way, and that often involving family members, especially if someone's sick or dying, and no family members, no visitors have been allowed in the hospitals for months now. So that's one of the hardest things. We're used to seeing people sick. We're not used to seeing people sick and alone. So that can be tough for everyone involved.
That sounds very emotionally challenging to deal with. In your opinion, do you think there are any misconceptions that people have, or in your experience, about COVID, about the severity of the situation?
I'm sure there are bound to be some misconceptions in both directions. People, I'm just so deeply involved in the medical side of it. I'm not actually sure. I can't really judge what the public perception is. I don't even really have time or choose to watch the news much anymore. I can imagine people who aren't seeing people sick might be struggling to understand the need to stay at home and follow the guidance that has been set out for the general public. I see healthcare workers getting frustrated because they're overwhelmed, they're overworked, they're starting to burn out, and people want to go outside and go to the beach in crowds. But there's always two sides to the story. There's two arguments to this as there is in everything in life. So yeah, there may be some misconceptions. People may not understand it fully or may think it's worse or better than it is, but I think it's hard for me to really say because, as I said, I've been so deeply involved with the medical side of it.
Almost too close to it to sort of take that temperature. So how exactly what was the precipitating event that got you started printing the masks?
Well, I've had I bought one 3D printer, a really, entry-level printer a couple of years ago to make spare parts for my car and do projects around the house, building fuse holders and circuit breakers and, little electrical engineering type parts for projects. And then it sat I hadn't used it in about 6 months. And I thought, maybe I should start designing some stuff on the side because I did sort of have an interest in biomedical engineering, medical devices. So I brought it from my hometown. I brought it up to my apartment now. I woke up one day as COVID was just starting to make it into the news, and I looked at it and I kind of thought, what can I do to help? Because I have spent 2 years teaching myself how to design and print. So I thought, maybe my original thought was, hey, I'll figure out a good mask, make 20 of them, and then if it ever gets really bad, I'll say, hey, I have some if anyone wants some. And then it just blew out of proportion. I went from having one printer to 5 and then up to 21 eventually, between 2 hospitals. So it accelerated pretty quickly. I started just looking online because there are a lot of good websites out there where people share their free open source designs. And I thought, I'm sure something exists already. And there were 5 or 10 mask designs out there when I started looking. And all of them had flaws or drawbacks, in my opinion. Some of them weren't fit right, weren't reinforced right, and one of the main problems is the mask.
I'm sorry, could you just repeat that last part?
Sure. So one of the main problems with all the masks online, except one, was that there wasn't a big enough surface area in the filter to have enough airflow in and out. They all had these small openings and enough filter material there, it's almost impossible to breathe through. So I found one design that I thought had a ton of potential. I ended up becoming friends with the original designer in Slovenia, and we FaceTime frequently. And I modified that, 6, 7, 8 times until I got to something that I thought would be a good first version to release my version of that. And then after that, it just took off. I started printing hundreds of masks, and I got a whole nother team involved. I found a designer in Nevada. I made friends with a couple designers in Italy and Spain and Canada. And we all the whole thing about open source is that everyone's happy to collaborate, share ideas, share files. No one's trying to patent it, and it's just open. Like anyone can change it, and it's a group effort to improve something to help the whole world. No one's trying to make money off it or anything. So that's where it came from.
I think that's really been the most reassuring thing to see. It's just like these are some tough times we're dealing with right now, but people really did step up in the early days of the COVID outbreak to try to make these things available to as many people as possible. I feel like there was a period there where I would see a new design every day, or like a new attempt to help with the problem. I think at one point there was actually a news story about a pair of Italian doctors who found a way to 3D print a valve to convert a scuba mask into a respirator, which is pretty incredible.
Yeah. There's another couple of Italian guys who made a oxygen a Venturi valve. It's a flow valve that goes in a ventilator circuit, and you can hook up oxygen so you can add oxygen to the flow into the lungs. And a company had run out of them and wasn't able to ship them out to keep up with demand. So these guys decided to 3D print it. And originally the parent company who invented it was not very happy about that they were making all their products for them in-house. And they got some popularity in the news about that. Should it be okay to, in an emergency, mass produce something, or where do patents come in? And it's all this debate. But I think one of the biggest things that's shown up from all this is not only the ingenuity of people in a time of need, they're willing to create something and give it away for free. The designs, but that if you have some way to manufacture it at each location, like 3D printing is very slow compared to other methods, but if everyone has a 3D printer in their hospital or their house, you could send a file out to the whole world and everyone can make it right where they are. There's no waiting for it to ship for a month on an ocean liner or by plane or anything like that.
And as we've all seen, there are certain very problematic aspects to having this enormous intercontinental supply chain, especially when you're dealing with such an international crisis such as this. I think certain countries have banned export of PPE, even if they're one of the world's main suppliers. And it's so interesting to see this moment where this sort of decentralized open source production is really coming into its own, and I think it's very encouraging. It begs the question, though, do you think that 3D printing can make medical equipment, once the crisis is done, can this really make an impact on the way that we produce medical equipment and the way we do medicine more broadly?
Yes and no. Yes, it can, but no, it probably shouldn't, as there are better methods. Essentially COVID has put the whole world into a wartime scenario where you're just doing stuff you never dream of doing out of necessity, such as 3D printing a mask, when before we had, years and years of research going into making masks effectively and cheaply, and it's the supply chain disruption that you're talking about that you're right about. So yes, you can definitely make some medical devices, maybe like a hose adapter here or a small piece of plastic to connect something else there. But reinventing the wheel from scratch in 6 months isn't going to be better than a wheel if you have the wheel. So I think 3D printing is good in a time of emergency. It's really good for prototyping and it's good for certain applications. But overall, if we have access to the best of the best materials that we've had all along, we should obviously use those before a homemade type of device.
Of course. But are you optimistic that maybe in the future, as the technology becomes even better, this could become the gold standard? Maybe not. It's hard to say that because we can only imagine, or we can only evaluate what exists now. But I'm very optimistic that this will get to a point where you could have a hospital 3D printer that just produces what you need at a medical grade.
Yeah. I do think so. I think that even 10 years from now, I would hope that every hospital would have and a biomedical engineering department with the ability to produce on demand exactly what you need in a clean room using medical grade materials. It's not going to replace simple things like a very simple face mask that just makes more sense to buy 50,000 of them have a cargo truck come in and drop them off in your warehouse. But for something that you might only use once every few months, like for a specific type of surgery, instead of ordering them and having them expire or having to store, huge boxes of them, if next week I need one of these adapters, just print that one and be ready for the surgery. It's going to definitely hold a place in that area for sure. Also, if you're in an area that you can't access very well, if you're out in a really remote area, anywhere in the world, even in this country, there's parts of this country that would take a couple days to get through, dirt roads, really remote areas where people still get sick and they need medical care and they may have one small clinic and you got to wait for something to come in. If you can make it on demand right there, maybe it takes 10 hours to print on your printer, but it might take you a week to get it by mail. Print it overnight, you'll have it in the morning. So yeah, that and military applications, if a nuclear submarine is out for 3 months and you need a device, you can make it where you are,
So do you think there are maybe some applications where you need something very personalized to the patient? Like, let's say they have maybe like a difficulty breathing, or maybe they need protective equipment that's very unique to them. Is this an avenue which could be an avenue for 3D printing to help in the medical field?
Yes, for sure. The great thing about where the technology of all 3D design is now is you also have 3D scanning. Right. So you can scan someone's face and print. There's even a free app right now on iPhone where you can do a 3D scan of your face and then get a file to print a mask adapter that is right to your jawline, right to your nose structure. So, yeah, I think 3D printing a custom piece for a fit is great. You're already able to do a CAT scan of someone's. Let's say someone shatters part of their face, the bones in their face. You can CAT scan their entire head, and you can create like a replacement bone. You know.
Wow.
So we're looking at facial reconstruction. I mean, it could be anything you can think of to make an exact replica. A femur. Maybe you could 3D print a femur out of a matrix and then have stem cells grow into it, and you just regrow a bone and implant it.
I think this is one of the areas that needs to be brought up more often when talking about the medical applications of 3D printing. There is a foreseeable future, and of course, it's hard to say exactly how it will play out, but we are in the beginning stages of seeing this ability to actually 3D print tissues, which, given how many different waiting lists there are for various tissues, grafts, and other things, is just very, very heartening to see. So I was wondering if you could tell me a little bit more about the impact of your projects so far. How have they been received? Are people trying to spread it to other hospitals? What has been the response?
Yeah, so when I first initially had my first revision of this mask, made my first YouTube video, within a couple weeks it got close to 100,000 views, and I got emails from, it started out with kind of word of mouth. A lot of the doctors I work with were sharing the video with hospitals all over the Northeast mostly, and then broadly in the United States. And within a week, I had about 15 different hospitals who kind of wanted me to be their consultant on how to set up their own in-house 3D printing, what kind of materials they'd need, have just a general overview of how to do what I was starting to do in case it came to that last resort. Because again, these are last resort masks. They're to replace something if you still have it. But people want to be prepared. They didn't know how bad it was going to get. So I had at least 3 hospitals in every major city, New York, Boston, Philadelphia, all over, calling me and asking for advice. And it was a strange experience. I mean, I've been a doctor for about a year, and I have heads of, the vice president of a hospital or the head of the medical department administration for the whole network of their hospitals in their state. People have been in practice for 30 years and are experts and world-renowned, calling me for advice on what 3D printing could do for COVID. And I quickly, I'd done a month of research, and that put me as an expert in this small niche field, which is a weird experience. But no, the impact, to answer your question, the impact, I help people set up their own factories on smaller scales. And then I raised enough money to as many masks I could possibly make on 20 printers in 2 months. And I've been shipping them out. I've been shipping them all over. I've sent to hospitals in every major city. I've even sent masks and face shields as far as Florida. There's an orthodontist office in Florida who's currently open because they have my PPE. And I told them it's a last resort mask, and they said, okay, but we understand that your initial data is showing that it's up there with N95s, and we're willing to use it because we have emergency cases we have to do. And that's a little bit different when it comes to a dental office because they're kind of their own boss. They make their own decisions. Most hospitals I talk to are saying, great, we'll hold on to these as a last resort and we want to analyze them, but we're not going to use them in the hospital. Nor am I recommending that. No one should use these unless they're completely out of real N95s.
I think we've all seen the images of doctors and other medical professionals wearing everything from bandanas to T-shirts to, yeah. It just goes to show the severity of the situation, even now. So you mentioned funding. So you formed a GoFundMe. How have people responded to the GoFundMe so far?
Very well. I've had thousands and thousands of shares of my GoFundMe link on Facebook. It started off with a lot of friends and family donating, and quickly I saw names pouring in with donations from people I'd never heard of, strangers, all wanting to support the cause, which really, it's heartwarming to know that people are willing to, a lot of these people are sitting at home not working, worrying how they're going to pay their rent, and they're willing to give you a little bit towards trying to help you and your colleagues stay safe, and develop this, because it's been amazing. I mean, I've been able to purchase additional printers, lots of supplies. I mean, there's a lot of stuff that goes into making one of these. It may only cost $3, but it takes me over 30 minutes to assemble each one, and it's very time consuming. And all the volunteer work is, free. All the doctors they do a 12-hour shift in the ICU. They'd come over and they'd help me for 3 more hours before they went to bed. And then we'd send them off to doctors at other hospitals we'd never met in our entire lives. And it's just the working together that's really been heartwarming.
If people want to help, how can they? Should they be donating money? Should they be getting their own printers? What can people do? I'm
biased because I just think 3D printing is so incredible as a technology. I think it's amazing. And once COVID's over, I think there'll be other applications, and everyone can use one if they have one in their home. There's some good entry level, very affordable printers. So as a hobby, I think it's great if people want to buy their own printer and learn how to use it and make even simple things like the ear savers you and I had talked about before that go behind the ears, right, and the pressure. Those don't need to be really approved the way a mask would. If a nursing home, for example, down the street, you could find somewhere like that, and the nurses there may have their ears hurting every day, and it'll save their ears and get the pressure off, and that might make their life easier. So that's one way directly. There are many organizations out there like mine that are fighting to make a difference that you can donate money to as well. I'm actually in the process of starting a nonprofit to apply for much more grant money from large organizations so that I can seek further testing and then certifications for my mask. I'm always, once I have the nonprofit set up, I'm always willing to accept, monetary donations. But I think one of the biggest things you can do is not give me money, but follow guidance. Like if you're being advised to do a certain thing like social distance, trust the medical professionals above anyone else who you see on the news, and do what they advise. It's for everyone's. We want to help everyone get through this safely. That's it. Just listen to advice. That's what I request of the public.
Yeah. It's very strange to see people who were only a few months before very notably concerned going to beaches, to parks, and on one hand, you can't blame people who have been trapped inside for months to want to go out, but it's something which could have some pretty profound repercussions later if there is a second wave.
Yeah.
As we've seen in most countries who were ahead of us in the infections. So for anyone who's curious, this is what Chris was referring to when he mentioned ear savers. It's essentially a plastic strip with these little knobs for holding the mask in place, which would go on the back of the head and sort of keep it off the ears. For anyone who is interested in helping but is maybe uncertain about producing personal protective equipment with the risk of failure of a mask, it's a great way to get your foot in the door if you really want to help. So that would be I wish I could recall the name of the Thingiverse creator who actually created the file I've been using, but absolutely it is available to anyone who has a printer and a Thingiverse. Access to Thingiverse.
Thingiverse is a great site. It's THINGIVERSE.com, Thingiverse. And it's a place where everyone just posts, their open source files for free. And it's where I start whenever I want to make something. I always check there first to see if it already exists.
It's interesting to see the sort of rise of open source culture, for lack of a better word. Do you have any feelings about where, even outside the medical context, where that sort of open sharing sort of culture could take us, especially in regards to 3D printing?
Yeah, I don't even know where it really came from. I feel like in previous generations, people were there's still everyone who wants to make it something, and they work for a company who wants to patent it and make money on it. But I feel like overall, the younger generations seem to be more open to just sharing, sharing ideas and collaborating. I shouldn't say the younger generations. I should say people in this day and age. It's not about age. I think it's like 2020. People of all ages, there's 10-year-old designers, there's 80-year-old designers.
Right.
I feel like this time period of 2020, give or take, everyone seems to be very willing to share their ideas. I think where it'll take us is much more rapid innovation. If people are willing to collaborate instead of all working on, let's say, 10 people have the idea to make an ear saver, and they all sit at home not wanting to share. Or look at the electric car and just the self-driving car industry. That's a perfect example. Everyone's trying to solve the same problem on their own, and then if they just collaborate, you can get it done more quickly, and it benefits at least the general public. And I think so. Individual designers at home, they don't work for a big corporation. I think that they're happy to share things and then receive other people's ideas in return, and that's going to help people. I mean, think of what we're going to accomplish. When I looked, there were 5 masks. There's got to be 30 masks on Thingiverse now that have potential, and those are just going to sit there. People are going to probably stop making them once this pandemic is over, and they're going to sit there, and then the next pandemic that comes along, there'll be 30 to start with. And times like this promote rapid innovation, but those files don't disappear. So every time there's a need, people develop, and then it'll be there to use next time.
Do you think that might be sort of a cultural artifact of the internet broadly, of growing up in a world where music is essentially free? It can be copied as many times as imaginable, where oftentimes the best way to get people using your product is to give it away. Do you think it's maybe just a broader cultural shift in that sense? Like it's what works?
I didn't really think of that. That's a great point. Yes. I mean, I grew up, I can get, like you said, most music is free. Even if you have to listen to an ad, you go on Pandora and people accept that. There's that trade-off. If all these files were available with a 10-second ad that you had to watch first, people would still download them. It's definitely a cultural shift that you're not going to pay, $20 for software and then find out if you like it. These masks, all these 3D printed items, you can just see if you like them right away.
I like to imagine what a world would be like, just as sort of a mental exercise, where you really had a post-scarcity society, and obviously the whole like Star Trek cliche is the go-to. But when you're talking about like a 3D printer which can produce very complicated objects, and you have this innovation and these ideas and these files which are becoming or have become completely free, really you're getting to something where the only restriction is materials on producing wealth and quality of life. So it's a very interesting time to be alive, I think.
It is. And the beauty of it is that in general, raw materials cost the same everywhere. There's different import taxes and shipping and whatnot, but it should be that the same, doesn't matter your GDP per capita or your exchange rate, one roll of plastic filament for a printer costs about the same everywhere. I mean, that's just what it costs, how much it costs to produce from PLA is the most common, for example. It's made from sugarcane and cornstarch. So you got to get those two, you got to put them together, you got to add a color to it and heat it up and make it into a roll. I mean, that's going to cost about the same anywhere. So you do kind of have that growing equality that, if you can get the materials, you can make it.
Yeah. It's interesting also mentioning PLA. I've never put this to the test, but I have always heard that it's biodegradable, which I'm not putting it in my garden. But, good first step.
Yeah, I mean, if it is made from glucose and cornstarch, then it should be. I think I read online somewhere someone made a bird feeder out of it, and it sat out in the rain. I think adding water is the key. So after like a year or two, it started to kind of dissolve or something like that. So regular plastic doesn't do that. It'll take however many thousand years. So it's probably a little bit more relative. But I'm not putting any in my garden either. Although, you know what, PLA, they are putting in bone grafts. Or actually, I think it's tendon. Like if your
Really?
tendon, like you have your muscle, you have a tendon, and the tendon anchors to the bone. So I think you can, it's either tendon or ligament that they're putting a PLA anchor in, and then the bone grows over it, and it absorbs, bioabsorbs and disappears. So it's used in, I think I read that a couple months ago, that it's used in some implants. So if the human body can absorb it and it dissolves in water, I think it's definitely the safest of all of the, plastics out there like ABS, PTG, TPU, all those acronyms.
That's so cool. Do you know of any other, I'm taking this down for personal notes. Do you know of any other examples of PLA which is actually being used in not implants, but like internally?
I don't, not off the top of my head, but I'd be willing to look into it. I'm sure there's quite a few. That's just the one I can recall.
Whew, what a time to be alive.
Yep.
I'm just waiting for the PLA recycler, to be totally honest, because I have so many bad prints that are just sitting there. I'd save so much money on wood.
Yeah, and what you're referring to, I think, is where you kind of shred it, put it into a vat, and it'd melt it, and then you make your own new filament from it you can use again, right?
Yeah, exactly.
Yeah, there's some open source designs for them. I saw some website that showed a few, but I don't know if I don't know how automated they are. I don't know if it's going to jam or how consistent the filament production will be, but I would love that too. I mean, think about if you could, my dream, probably no reason to really go down this path, but would be to collect water bottles, like plastic that you'd normally recycle, melt that down into filament, 3D print bricks, and like build a house out of it.
It's so funny you mentioned that, because one of the things that really, so in my previous episode that I did of the Moot podcast, I had someone on and we talked about three big economic challenges that are facing people today. These are three areas that have become more expensive over time, as while like electronics and food and everything else have sort of decreased. Yeah. And the three big areas were housing, healthcare, and higher ed. So the fact that you bring up housing is very interesting. And it's also worth mentioning that they do have 3D printers big enough to make houses now. Have you ever seen those?
Yeah, don't they extrude concrete basically?
Yes. Mm-hmm.
In layers? So your house has like ridges on the walls, but it's massive scale?
I think they probably have someone like smooth over those personally. But yeah, you got it.
Yeah, I have seen that. That's amazing.
I think they are using either shredded plastic or some other type of fiber to hold it together. It's not pure concrete. So that's a good way you could use those recycled bottles.
Yeah. Definitely.
So it's just another way that you could theoretically bring the price of housing down to meet demand. So obviously there are plenty of reasons why people don't want the prices of houses to crash to zero, but it's in a post-scarcity world, it's something we can all hope for.
Yeah, and I don't think 3D printing bricks will ever replace normal
Probably
houses.
not. No, people like wooden houses.
But maybe you could make some sort of insulation or siding or something useful out of it.
Yeah.
We have to recycle. We have to if we want to. There's only so many resources on the earth and so many landfills.
Yeah. I mean, hopefully someday they'll design a robot that skims plastic out of the ocean and turns it into those houses or masks or ear savers or anything you need.
Yeah.
We can dream, right?
Yep. If you want, I can actually show you one of these.
Please. Absolutely. Is this the first model?
No, this is the more recent one.
Okay.
I don't have any of the... I actually brought home a box because what I like to do in the evening, even though I worked all day, is I'm going to tie the straps on that actually hold it to your head.
Oh my
This
God.
is my evening activity. And then in a couple days I'll ship those out somewhere. I'm a little behind actually on shipping. So actually I've gotten the chance to learn a lot about injection molding too. Little side note. Injection molding is where basically everything's made out of plastic normally is injection molded. You carve out a mold like out of aluminum and you shoot molten hot plastic in at something like 200 tons of pressure, and then the machine opens up and the piece pops out. So you can make this black piece here is actually injection molded by a local company who's offered to help me make these masks until COVID's over for free. They're just making them for me. So I no longer have to print the filter box and the mask. I just print the mask, and they're providing me with the filter box and the square that goes inside to hold the filters in. They can make one of these every 30 seconds, but it still takes me about 3 hours to make a mask. So that's just to put it in perspective. So 3D printing may not be the fastest way, but like I said, if you don't live 20 minutes from a huge manufacturer, you can print it at home. But these go together. They're strap points. It goes over your face, and there's three layers of filter in there. We've done a lot of testing. I've gotten to work with the U.S. Coast Guard Academy. I've been discussing with working with Yale, UConn's labs, even had some phone calls to Cleveland Clinic and MIT and Harvard. And we're all sharing ideas, some data about filtration. So I've gotten this to a point where I am seeing that I'm filtering 8% of small particles, 0.3 micron particles to be exact. So that would be an N98. There is no such thing as N98. It's N95 or 100. So anything over N95 is just called N95. So I am seeing some data, at least out of one or two of the labs I'm working with, that's showing these are up at the N95 and above level, which is very exciting. But I don't have them like certified as N95s yet or anything. But the data's there, and I'm working towards it for sure. I want to get some NIOSH approval. But as of now, this is considered equivalent to a bandana, which I find funny because I started this project out saying, okay, the CDC says you can wear a bandana or a scarf if you've run out of other stuff, and I think I can do better than that. That was my goal, just do better than a mask, or do better than a bandana. And I can safely say I have, but in the eyes of the government, this is still a bandana, so don't get that confused.
Gotcha.
But perfect seal. I had a rubber trim around the edge, and I had straps, and we fit test them where you go inside basically a garbage bag and you spray something that smells and tastes terrible. And if you taste it, if you have a leak, you will taste it.
Right.
And we do this for all of our normal N95s as well to make sure you have the right size. And there's different sizes. This is for a very small face. This is for most people fit this one here. So it's been pretty good so far. I mean, I wear them occasionally. Like I'll wear them into Walmart. Like people.
Do you get looks, or do you get looks of envy or confusion?
Confusion, although not that many, because I've seen people wearing some pretty outlandish things in stores. Yeah. So it's in the beginning I was getting looked at. Now no one looks at me twice.
Yeah, I've seen some odd things. Most of them, I'm happy to say most of the really strange things I've seen have been online, but people get creative.
Oh yeah. I've seen some stuff online too.
Have you ever seen, do you know those sort of inflatable dinosaur costumes?
Yes.
So here's the thing about that. It's ridiculous, but not necessarily crazy. You're creating pressure or positive pressure, right? If it's filtered, I guess, the air that's coming in.
Oh, but, they have an electric pump? Are they always pumping air in?
Yeah, they're pumping air in, filtered air in, and it's pushing out it's so crazy, it's almost genius.
Like the T-Rex?
Yes.
Costumes?
Going to stores. Yes. Yes.
That's what we have to go into the COVID rooms is a PAPR. It's a hood with positive filtered air. So yeah, if you want to dress as a dinosaur in Walmart, go for it. I could recommend that, I guess. I mean, don't.
No, please don't.
Just stay home.
Yeah, stay home.
No, people are getting creative for sure.
So would you say overall you're optimistic about the situation, as optimistic as a human can be with limited knowledge, or do you think Please?
Yes. I am now, because the summer, I think most predictions are showing we'll be okay through summer. I'm really worried about flu season.
Yeah.
I'm very worried, actually, because you'll have the flu and you'll have COVID, and a lot of you need a certain number of people who've been exposed and have antibodies to have herd immunity, and from all the studies I've shown, we're not even close to that. So I would predict, and I want the best. I mean, I hope for the best, but I'm very cautious. I fear that next winter is going to be tough. I also fear for future pandemics. I mean, look at the statistics on the death rates of this. What if we had something like where 50% of people who got it died? I mean, this is a dress rehearsal. It's both terrible, and you're seeing friends, you're seeing people lose family members, and it hits close to home, and it's very serious. It's terrible what's happening. A lot of people are dying, a lot, and then the people who are staying home. Let's say you have heart failure, and you normally go to the doctor and have your diuretic, your water pill adjusted or something, and you don't go because you don't want to sit in the waiting room and get sick from someone with COVID. Now you're waiting 2 months until you're, gonna be having fluid buildup in your lungs, or if you have chest pain, you ignore it. Turns out you had a heart attack, and you come in a week later because suddenly your heart has a much worse problem. You're seeing both COVID and you're seeing people avoiding the hospital, causing two separate but equally kind of scary problems. And that could happen again with a second wave, and probably will. And what if in 10 years the next worldwide virus is even worse? I mean, this is bad, but it could be so much worse. So I'm hopeful in the fact that I know how much worse this could be, and I think we're going to get through it. But I'm also worried for what this is an example of that could happen again in the future.
Specifically with people who are afraid to go in to see doctors, do you think that at least partially telemedicine could help with that? Are you seeing more of that than normal right now? Yeah. Yeah,
telemedicine was just kind of starting to take off. If you had some simple symptom and you needed like a simple prescription for something, it's been great for a few years now. This is going to push it into a mainstream area, though. This is going to, I think, especially if the legislation changes so that doctors can get paid the same for a phone call visit as an in-person visit, that will really allow doctors to keep their practices going, cover their costs while not making an elderly patient come in for a simple checkup when you're just most of it's talking to them. Where it might be appropriate for them to not have to come in. So I think it is going to make this not the new normal, but much more mainstream and popular. And it makes sense, especially if the main physical exam in person is a vitals check, and someone can have a device at home that checks their vitals, for example.
Right.
The doctor can check their vitals. What if we get to the point in 10 or 20 years when someone can take a tiny blood sample and their iPhone will then send all of their lab results immediately to their doctor, and you can tell you, oh yeah, your kidneys look fine, your heart looks fine. What's the point of someone, especially if they can't drive themselves, coming in on like a transport ambulance, sitting in the waiting room, getting sick from people? There's certain patients who telemedicine will do more help than harm for, and that's being elucidated by this pandemic for sure.
Absolutely. I'm getting a little bit of feedback. Did you change anything?
No, sorry, I didn't.
Okay. Seems to have stopped now. Anyway, I think in general, I'm coming out of this conversation feeling more optimistic than I was.
Good.
Yeah, maybe that just means I wasn't super optimistic because it seems like we will likely have a second wave. But I am reassured, if by nothing else, than by people's willingness to sort of do things for no other reason than helping others, which I think is really, yeah.
I've been blown away by the generosity of human beings that I've come into contact with. So many people are willing to, put in so much work to make a difference. I just even looking online, you'll see a bunch of people getting together and sewing 1,000 masks and donating it to the local fire department or something like it. No one's asking them to do it. It's people like that. I mean, who really make me want to get up and go to work and deal with the same tough situations over and over again.
Another 90 hours of residency and then 6 hours of stitching masks together? Or
Yeah, but it's worth it. It is.
yeah. Well, Chris, this has been a fantastic conversation. I wish you all the best. You're genuinely a hero in my book. I don't think I could do medical residency, let alone medical residency during COVID, making it's heading a technological revolution, basically.
Well, I've had a ton of help, but thank you. It's a lot of work, but it's rewarding, and I couldn't have done it alone. I have, 20, 30 people involved in this project with me who jump in and out to help. So, and it's people who get the word out there. Thank you for everything you're doing in this podcast and the efforts you're doing to make the public more aware of what's going on and what they can do to make a difference.
I'm sitting here. For all you know, I'm wearing pajama pants. So, so is there anyone you'd like to shout out? Any GoFundMes you'd like to let people know about? Anything else you'd like to let everyone hear?
Just all the healthcare workers. People really are going out of their way to try to help the patients right now. Everyone from the people who work in the laundry department who are getting exposed through the sheets that you don't even think about like that often, the cafeteria workers in the hospital, the doctors, the nurses, the medical assistants, as well as the hospitals I worked at so far, UConn, Hartford, and St. Francis, and all of the attending physicians who help buy me printers and give me a space to work. Everyone's been so kind. And that company I mentioned is injection molding for me, and a local community college, Goodwin College, has been helping make masks for me. There's local high schools, Boy Scouts. Who else? It's amazing. There's a robotics team of a bunch of freshmen in high school who are making masks for me, and working on their robots. I could go on forever. It's people just come out of the woodwork and make a difference. I'm grateful to all of them. I am always accepting donations to my GoFundMe. I'll use every penny I possibly can, and any extra I'd give to the next worthy cause and pay it forward. So you could link that if you want. But yeah. Just everyone's making a difference. I know people keep saying, and I hate the cliche, but we really all are in this together, and it's true. So just stay strong, and we will get through this.
Chris, thank you so much. Everybody, I hope you've been uplifted a little bit, and that's the moot. Take care, everybody.